My name is Collin McGuire, and I'm an undergraduate student at Arizona State University. And the past year and a half or so, I've been studying HIV, and I want to pursue a career in a HIV related public health field. So, from all that introduction, it may seem as if HIV has been a part of my life since I came out the womb or something, but that's actually completely not true. I haven't As of 2 years ago, I didn't really care about HIV. I knew HIV was a virus, and I knew that some people got it, but beyond that, that's all I knew about HIV. I didn't know anything beyond that. So I really want to stress that HIV isn't some super esoteric topic that's hard to understand or requires reading a bunch of research papers. Anyone can learn about HIV, and it's quite easy if you just learn a couple facts. You can protect you and your loved ones from HIV. So HIV is a pretty delicate topic, so if at any point you feel uncomfortable or want to pause the video, feel free to do so and maybe take a walk around, decompress, whatever you need to do to make yourself feel comfortable. So does anyone know if HIV has a cure? Okay, so HIV does not have a cure currently. Despite modern medicine's best efforts so far, there is no cure for HIV. However, there is an effective cure for HIV, which is treatment. So today, the treatment for HIV is really good. Without HIV treatment, a person with HIV will die in 8 to 10 years. But with HIV treatment, a person can live as long as they would have lived without if they didn't have HIV. Sorry, but so HIV treatment is really important. But the only way to get HIV treatment is for a person to get tested. A person who has not been tested positive for HIV will not be given HIV treatment because HIV treatment can have toxic side effects, so it's not medically sound to give that treatment to people who simply don't need it if they're HIV negative. So how does one get tested? The easiest way for a person to get tested is just to search online, free HIV testing, and then whatever area you're located in. Tulsa, Kansas City, Phoenix, Bay Area, anywhere you are, search that on Google because most communities will have free or at worst very low cost, around $20 testing. And this testing is both fast and confidential. So testing usually takes around 20 minutes if you get it with a healthcare provider, and the results will be given immediately after the test. So a person, if they're tested for HIV, will know if they're HIV positive or negative about 20 minutes after being tested. There's no long 2-week wait anymore. It's now only 20 minutes to get tested. And the results are confidential. So the only people who will know the results of that HIV test are the person who got tested and the person who delivered them the results. If a person who got tested wants to disclose their results to people, they're free to do so, and those people will now know the results of the HIV test. Otherwise, only the person who got tested and the person who gave them the results will know. So how does HIV testing work? It works by using blood or saliva and checking for the presence of HIV antibodies in that. So saliva is slightly less effective and is what is used on HIV testing kits. Now, home testing kits. Don't get me wrong, saliva testing still works. A person still will be able to find their HIV results. It's just very slightly less effective than blood at finding HIV. And the other benefit of getting tested in a clinic, which uses blood, rather than at home, which uses saliva, is that in a clinic, a person has access to a healthcare provider that can set them up with an HIV doctor, get them on treatment immediately, and it just provides a better support system than a person taking the test at home. So it's really important to go in and get tested pretty soon. It's free, won't cost you anything, and you'll be able to protect yourself and your loved ones from HIV. And so what does an HIV negative or a positive test mean? So testing positive on an HIV test means that a person has HIV, and that person will be eligible for free to low-cost care for their HIV, an HIV doctor, and then if a person can afford the treatment drugs for HIV, they'll be given access to, again, free or low-cost treatment. So a person doesn't have to be rich to treat their HIV. Anyone can treat HIV. Anyone is eligible for those programs. An HIV negative test means that a person's antibodies were not found. HIV antibodies were not found in a person's blood or saliva. So HIV antibodies take, on average, about 3 weeks, but sometimes up to 3 months to develop in a person's blood. So if a person has been exposed to HIV less than 21 days before the test, that person should get tested again 3 months after that test, because at that point, 99% of the people will have antibodies for HIV, and a negative test there will mean a person definitively does not have HIV at that time. So just to recap, most important thing to remember is that HIV testing, it's fast, it's free, it's confidential, and if a person gets tested today, they can help protect themselves and their loved ones from HIV. Thank you.